I'm your host, Marketing and Communications Manager, Natasha Letzum. On Saturday, February 16th, the BVI Health Services Authority will be hosting a cardiac symposium to update medical professionals and patients on the latest cardiovascular management strategies and to bring awareness to the impact of cardiovascular disease in the Virgin Islands and the Caribbean. We have with us two doctors to speak more about cardiovascular disease and the symposium and its related activities. This will be part one of a three-part mini-series as we get up close and personal with cardiovascular disease. Our first guest is Dr. Christelle Bovell-Chichester, here to give us the rundown on cardiovascular disease. Welcome, Dr. Chichester.
Thank you for having me.
Always a pleasure interviewing you. Tell us a little bit about yourself as a doctor.
So I've been in the business of medicine for about 15 years, so just under 15 years. A lot of my undergraduate work was done in Guyana, where I was born, and most of my postgraduate and specialty bits were done in Barbados at the University of the West Indies.
Mm-hmm. Tell us a bit about your role here.
Sure. Mm-hmm. So I joined the BVI HSA just under 4 years ago. I currently hold the post of a consultant internist here, and that is my specialty area. So that deals essentially with all adult medical disorders. So anything from hypertension, diabetes, to patients with heart disease, kidney-related diseases. So just adult medicine. Mm-hmm. I deal with here at the hospital, both as an inpatient as well as I run an outpatient medical clinic.
Awesome. So what is cardiovascular disease and why is knowledge about it important?
Okay. So cardiovascular disease is relevant not just to the BVI, but globally. It is the #1 killer of adults, especially young adults in their very productive years. Cardiovascular disease, as simply put as possible, is any disease that affects the heart or the blood vessels, and that has implications for all the other vital organs of the body, because of course you need blood flow to organs to provide nutrients, oxygen for their functioning. You'd find that atherosclerosis, which is the process that underlies a lot of cardiovascular diseases, results in plaque formation within these blood vessels, made up of a lot of cholesterol and other debris. And of course, once you have any sort of blockages or impedance in any plumbing system, mm-hmm. you can see that there's not going to be adequate flow of blood to those organs, and you end up with conditions like heart attacks, strokes, kidney failure, for some patients heart failure, normal rhythms of the heart, quite a few mm-hmm. quite significant conditions.
Mm-hmm. Before we go a bit deeper in some of these conditions, I want you to just tell us what are some of the overall risk factors for cardiovascular disease.
Okay. So I'm sure a lot of the public already is aware of a lot of them, but I reiterate for their benefit that the things like obesity, mm-hmm. sedentary lifestyle. I've mentioned that atherosclerosis is buildup of plaque, which consists of cholesterol, so elevated cholesterol mm-hmm. Is a risk factor for cardiovascular disease. Hypertension, but not just hypertension, but uncontrolled hypertension, because some persons perhaps have been diagnosed with hypertension, but if they're well controlled, their risk is a lot less of developing cardiovascular disease. Similarly, uncontrolled diabetes is also a risk factor for cardiovascular disease. Very importantly, cigarette smoking. Mm-hmm. It's actually an independent meaning not even related to the others I mentioned, independent risk factor for cardiovascular disease. Mm-hmm. So those are some of the main ones. There are a few others, alcohol to some degree as well does that, but the ones that I've mentioned are the main risk factors.
Okay, so let's talk a bit about heart attack. Tell us about heart attack and how they come about.
Okay. So heart attack is synonymous with death of the muscles of the heart, okay? Like any other part of the body or muscle in the body, it needs blood flow and blood supply. It needs oxygen. It needs nutrients to function. So you can imagine that if there's no blood flow to the muscle of the heart, the cells will die. And that essentially is what a heart attack is. But I've mentioned before, the precursor to developing a heart attack is this deposition of plaque within the blood vessels. And not just blood vessels of all the body, but the blood vessels that supply the muscle of the heart. Because this process of atherosclerosis actually is a systemic issue. It's not, it doesn't single out specific vessel. It tends to happen throughout the body, especially in the arteries. Okay, and that arteries is what takes blood flow to these organs. So a heart attack essentially is death of the muscles of the heart, and you can imagine that that has significant implications for the functioning of the heart. It can manifest in very many ways, but typically you'll find patients with a heart attack coming in with chest pains. The usually specific characteristics of the chest pain, it tends to be central, right behind your breastbone. It tends to be of a pressing nature and character, or some persons can report a little bit of tightness, or patients can come in saying to you, I feel like something is just sitting on my chest and won't get off. The pain can radiate, it can move from that central area, but it starts there typically. It can move to the left upper jaw, it can move down the left arm. So persons sometimes need to be aware of that, because we always think that, well, if it's not directly in our chest, it may not be related to the heart, but that's not the case. You can have radiation of that pain. And of course, associated with that pain, persons would say that they feel very nauseous. They feel like they want to vomit. They can be profusely sweating. They can feel like the heart is racing, or just an increased awareness that the heartbeat seems to be stronger. In addition to that, they can feel like as though they're going to pass out. And some actually do pass out, depending on how significant the heart attack is. I should also say, as a point to note, that elderly patients and young children and diabetic patients, their perception of pain is a little different. And so sometimes they may not even have the chest pains. They may just feel as though they're nauseous. They feel there's a little fullness in the upper part of their tummy. And so if you know you have risk factors for this, and you have this significant discomfort or nauseous feeling out of keeping what you might have ever had in the past, it would still warrant perhaps seeking medical attention to have that reviewed.
Definitely. Now, from a medical perspective, what should persons know in order to increase their chances of surviving a heart attack once they start to show some of these symptoms?
Well, I'm glad you've asked me that question, because that's one of the key things we've tried to drive home to patients. Because in this day and age, with the evolution of medicine, there are a few things that we can offer patients if they can present early enough. Okay. Now, there are a subset of patients that may not survive the heart attack of itself, just from the onset of pain. But there are quite a large subset of patients, especially with their first heart attack, that are able to make it to hospital. But in terms of what we can offer now, there is a medication, well, a group of medications, we refer to them as sort of clot-busting drugs. Okay? Because we know that, of course, a heart attack is that there is complete loss of the blood flow to the heart. It's usually because there was plaque there in the vessel, and then a clot formed at that area and completely blocked off the blood supply. So one would assume that if you can get rid of that clot very quickly, then you may be able to allow or reestablish blood flow to that muscle and try to save that muscle. But there is only a window of opportunity we have to do that, which is usually within the first 5 hours, 5 to 6 hours, let's say, okay? That if we are able to reestablish blood flow to the area, we can actually salvage the muscle. and the cells don't actually die. But of course, sometimes it takes a little of time from the onset of the chest pain to the person actually getting to hospital, and that's where we tend to lose a lot of the benefit from this drug. So we would say if you're having the onset of chest pain, the faster you can get to hospital or seek medical attention, then the better your chances of trying to revascularize that vessel, and as such improve your survival. Because oftentimes after the muscle has died, there's not a whole lot that one can do to try to recover the muscle. And a lot of times, whatever other interventions can be offered, it's really to reduce the chances of this happening again, rather than actually save the muscle that was injured on this occasion. So in terms of survival, the key is making sure that you seek medical attention as soon as possible.
And when they do present here at the hospital, how do you determine that they indeed suffered a heart attack, or is it something else?
Okay,
like gas
so
or whatever?
right. So oftentimes there are a few investigations. Of course, based on their history, it is suspected, and once it is suspected, there are tests that can be done. Some involving blood work, some involving an ECG, which is a simple test. It's just some electrical leads that are put on your chest, and it gives you an idea of if there's any injury happening to the heart at the time. But of course, it's confirmed with blood tests. And that is done, doesn't even take 10-15 minutes to actually get those done, so that if it is you present early, we can establish whether you're having a heart attack early, so that if it is that you're a candidate for that intervention, you can have it as early as possible and salvage as much of the heart muscle as possible.
Great information. Now, Doc, what's the difference between a heart attack and heart failure?
Okay, so a heart attack, as I said, it's really death of the cells. They are linked, because if it is, of course, you have significant damage to the muscle of the heart, you develop heart failure. Now, heart failure just means that the heart is not able to supply the needs of the body in terms of blood flow. Okay? I know in the past it has seemed to be synonymous, as though a heart attack means heart failure, but no, they are a bit different. They are linked in the fact that a heart attack can lead to heart failure, but heart failure isn't always associated with a heart attack. Over time, uncontrolled blood pressures can cause other injuries to the muscle of the heart. If you've had, for example, I mentioned earlier that alcohol can be a risk factor. Chronic alcohol abuse can actually damage the muscle of the heart, cause the heart to become very dilated, and as such the muscles can lose their integrity in terms of squeezing and their contractility, so that obviously affects the output from the heart, and as such, if your output from the heart is not enough, you're not able to meet the requirements of the body. So heart failure is not exactly a heart attack. They are related in that a heart attack can cause heart failure, but heart failure can be from many other causes, and it's really related to how well the heart can actually take care of the needs of the body.
So is there anything that can be done to influence heart health?
Absolutely. Addressing your risk factors. Primary prevention, I will always stress that. And when I say primary prevention, it means addressing your risk factors before you have developed heart disease. And even further to that would be addressing risk factors before you even develop some of the risk factors for heart disease. So addressing, your obesity, your physical inactivity, your dietary indiscretion, so you don't develop things like hypertension and diabetes. You don't become obese. Those are things, sort of call it primary prevention, and it can't be stressed enough. Because as we can see, these are things that are within the realm of our control. But after we've developed a heart attack, after we've developed heart failure, then it starts to step in the realm of, we're trying to use medications to try to, manipulate the function of the heart and so on. And oftentimes it's not all within our control. So I think we need to step back and start recognizing where we need to start in terms of our interventions.
Definitely. Now, can persons live a high quality of life after a heart attack or heart failure?
They can, in a select group of patients, I'd say. Post a heart attack, of course, if you were able to benefit from the intervention I mentioned earlier, then you're able to actually save the muscle of the heart. So in terms of your symptoms and your restrictions, it would be as the rest of the general population because you haven't injured your heart. So that's one. The second thing is that even if you have had a heart attack, you may need interventions to try to reduce the risk of this happening. For example, patients who have had a heart attack perhaps have already plaque in not just that vessel that was probably blocked off, but a few other vessels. And so there are interventions from cardiologists and heart surgeons that can actually attempt to clear those blockages or try to find alternative pathways for blood flow. And so we talk about things like bypass surgery, stents of the vessels of the heart. So those are interventions that can certainly optimize your function after having heart attacks. In terms of heart failure as well, optimizing your blood pressure control, optimizing your blood sugar control, reducing the risk factors as we've spoken about, adherence and compliance with your medications that are now going to be used to optimize the function of the heart. And in addition to that, it's not just being adherent with the medication, but being adherent with your follow-up in terms of with your primary care physician, with your cardiologist, with your internist, so that if there are any decompensations along the way, they can be nipped in the bud very early, because that helps with your need for hospitalization. It helps with your quality of life in terms of your symptoms. So those are some of the things I think that can certainly make a difference in terms of survival and quality of life after having had a heart attack or having heart failure.
Thank you, Dr. Chichester. We are speaking with Dr. Chriselle Chichester, who is sharing a wealth of information on cardiac disease. Let me remind you that this is part 1 of a 3-part mini-series educating the community about cardiovascular disease. So join us next time for part 2 as we return with Dr. Chichester to finish the conversation about cardiovascular disease as we focus on stroke and renal failure. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager Natasha Letson. Thank you for tuning in.